Dr. Moshfegh is a board certified in vascular and interventional radiology with a subspecialty in venous disease. Dr. Moshfegh will discuss TMJ syndrome and a nerve block procedure he uses to treat the condition. Dr. Moshfegh, welcome.
Thank you.
I guess the first place to start would be to tell us about what TMJ syndrome is.
So TMJ syndrome, the TMJ is basically a hinge that connects the jaw to the temporal bones of the skull, which are kind of right in front of the ear. And the TMJ helps you to move your jaw side to side, up and down, so you can talk, chew, yawn, things like that. Problems with the jaw and the muscles that control it are what's called temporomandibular disorders. And some of the symptoms of those include, pain, discomfort. They could be temporary or last for many years. It affects women more than men, unfortunately. It's ages 20 to 40. And then it can give you pain in the face, the jaw, the neck, the shoulders, pretty much pain almost all around the face there. It happens when you open your mouth wide. And you can get clicking, popping, grating, those type of sensations. It can give you ear aches, headaches, all different types of pain.
And so why do people develop TMJ syndrome?
So there's a lot of different causes. It could be, you could either have injury to the jaw or maybe like a whiplash injury. If you grind or clench your teeth a lot at night, it can cause pressure in the TMJ. There's a soft cushion there between the jaw and the temporal bone, and that soft cushion can move a little bit. That can cause some pain. You can get arthritis in the joint. And even stress where you like tighten your facial muscles and stuff like that can cause temporomandibular disorders.
What are the current treatments available for TMJ syndrome?
So there's a lot of treatments. We always like to start with conservative things like non-steroidal anti-inflammatories. You can put hot packs or ice packs. Don't open your mouth too wide. Don't rest the chin in your hand. There's different types of things you could try. Just try to keep the mouth at a safe distance. And then if all that stuff doesn't work, you could try different types of medications. Like some people try antidepressants and muscle relaxants, and then night guards, and sometimes even dental work, helping to keep the jaw better aligned, can help with the TMJ. If all of that doesn't work, there's other things that people have been trying. It's something called transcutaneous electrical nerve stimulators, where they actually stimulate the nerves. There's ultrasound treatments, trigger point injections, and then even the last ditch effort is probably surgery, where you do like a little arthroscopy and maybe clean up the joint, or even open surgery. But that's really the last line treatment for TMJ.
So tell me about how this nerve block works when you're using it for someone with TMJ.
So a lot of the pain that's associated with TMJ is due to the nerves that are around the face, like the trigeminal nerve, for example. So the nerve block that I do is a sphenopalatine ganglion block. It's kind of the neuromodulator for all the nerves surrounding the face, the brain, things like that. And as we block that nerve, it's kind of a nerve in the back of the nose there. The lidocaine that we use to block it also drips back and blocks the trigeminal nerve. So those nerves that are giving you all the pain and things like that will be blocked, and the pain will go away almost immediately.
So that leads me to my next question: is how well does this nerve block work for TMJ syndrome in most patients?
It's kind of an off-label use for TMJ, but it seems to work almost immediately. If the patients come in with acute pain and we do the block, then the pain almost immediately goes away. The length of relief is the real issue. It may last a few weeks, may last a few months. It's definitely not a permanent solution to the TMJ disorder. All those other things I mentioned are also part of the treatment plan, but it's a good, stepping point between some of the conservative treatments and the more invasive ones.
And what are the risks of this nerve block?
There's not many risks. That's why it's a good alternative. It's just lidocaine we're injecting. So really the only side effects that patients have is they can feel the lidocaine in the back of their throat, and they may get a funny sensation there. But besides that, it's a pretty safe procedure.
So how would a patient decide if trying this nerve block for their TMJ syndrome is right for them?
I would say if they've tried all the conservative options, if they've even tried some of the more invasive ones like the electrical nerve stimulators and the trigger point injections and the ultrasounds and all that stuff doesn't work, and the only thing they have left is surgery, then a nerve block may be a good option for them to try and see if they can get some temporary relief while they do rehab and other things to see if the TMJ can, the pain will go away.
So it's really a good therapy to kind of bridge them over to a final solution in the
Correct.
interim.
Yeah.
Are there other conditions that can be treated with this block?
There's plenty of conditions that could be treated with it. Interestingly, it helps for lumbago, which is pain in the lower back. It can be used mainly for migraines. Is the main thing it's being used for now, because the neuromodulator of the sphenopalatine ganglion controls all the pain that causes the migraines, things like that. You could have pain from fibromyalgia or endometriosis can be treated with this block, and also pain from herpes zoster or shingles can be treated with it. So it's a variety of things can be treated with this sphenopalatine ganglion block.
And what makes you uniquely qualified to perform a nerve block?
So, as an interventional radiologist, I'm also a board certified radiologist. So, I'm an expert in anatomy and also image guided, minimally invasive procedures. So, I can be confident that each time I'm putting that catheter in, I'm hitting the exactly correct spot. I use a very low dose CT and I know exactly where the ganglion is. So, I know 100% of the time I'm hitting it.
Well, Dr. Moshfegh, thanks for taking the time to speak with
Sure.
us today about TMJ syndrome and the nerve block treatment you use in your practice to treat this condition.
Sure. It was great meeting you.